Hello and welcome back. So today we're going to talk about criterion 2, feature A, and move on to criterion 3 of the hEDS checklist. So 5 or more of the following 12 things must be present for feature A to be counted as part of the 3 in criterion 2. Unusually soft and velvety skin is 1. 2 is mild skin hyperextensibility. 3 is unexplained striae distensae or rubeae at the back, groins, thighs, breasts, or abdomen in adolescents, men, or prepubertal women without a history of significant gain or loss of body fat or weight. That means stretch marks, and for women before puberty. Bilateral pyogenic papules of the heel is 4. 5 is recurrent or multiple abdominal hernias. 6 is atrophic scarring involving at least 2 sites and without the formation of truly papyraceous and or hemosideриc scars as seen in classical EDS. We'll discuss why that later. 7 is pelvic floor, rectal and or uterine prolapse in children, men, or nulliparous women without a history of morbid obesity or other known predisposing medical condition. Nulliparous means you haven't had children, and the reason for that is being pregnant can actually predispose you to that. 8 is dental crowding and high or narrow palate. 9 is arachnodactyly as defined in one or more of the following: positive wrist sign, Walker sign on both sides, or positive thumb sign or Steinberg sign on both sides. 10 is an arm span to height ratio of greater than 1.05. 11 is mitral valve prolapse, mild or greater based on strict echocardiographic criteria. And 12 is aortic root dilation with a Z-score of greater than 2. The last 2 is why it is recommended that you get an echo on a regular basis with EDS. Once you've met 2 or more of feature A, B, or C, then you move on to criteria 3. Criteria 3 is all of these must be met. An absence of unusual skin fragility, which should prompt consideration of other types of EDS. And an exclusion of other heritable and acquired connective tissue disorders, including autoimmune rheumatologic conditions in patients with acquired connective tissue disorders like lupus, rheumatoid arthritis, and other things. Additional diagnosis of hEDS requires meeting both features A and B of criterion 2 because they explain why you would have pain. Feature C of criterion 2, chronic pain or instability cannot be counted towards a diagnosis of hEDS in this situation. And 3, exclusion of alternate diagnosis that may also include joint hypermobility by means of hypotonia and or connective tissue laxity. Alternative diagnosis and diagnostic criteria include but are not limited to neuromuscular disorders such as Bethlehem myopathy, and other hereditary disorders of the connective tissue. Examples are other types of EDS, Loeys syndrome, Marfan syndrome, and then skeletal dysplasia such as osteogenesis imperfecta. Exclusion of these considerations may be based upon history, physical examination, and or molecular genetic testing is indicated. Basically, you cannot have vascular EDS, the cardiac EDS, any of the other types of EDS and have hEDS. That's a misconception. You cannot have Marfan syndrome and have EDS. That's a misconception. And when both of those are ones that are often heard of, you can only have hEDS if there is not a genetic cause to it, and none of the others are that. I will explain a little bit more about what to do if there's signs of the other types of EDS or some other genetic condition in the next video. Thank you, and I will see you all in the next video. Bye.